Welcome back to Medical Made Easy. In today's episode, we'll delve into the world of health assessment. Understanding what a health assessment is and why it's essential can be a game changer in your journey towards optimal well being. So let's get started. A health assessment is a comprehensive evaluation of an individual's overall health, covering physical, mental, and even social aspects. It's not just a doctor's task. You can actively participate in assessing your own health. Components of health assessment. Number 1. Physical health. Physical health assessment includes measuring vital signs like blood pressure, heart rate, and temperature. It also involves a thorough examination of your body, looking for signs of illness or any irregularities. Number 2. Mental health. Mental health assessment evaluates emotional well-being. It assesses your stress levels, mood, and signs of mental health conditions like anxiety and depression. Number 3. Medical history. A comprehensive health assessment takes into account your medical history, including past illnesses, surgeries, and family medical history. This information helps in early detection of potential risk. Number 4. Lifestyle factors. Your lifestyle plays a significant role in your overall health. Assessing your diet, physical activity, sleep, and substance use like smoking and alcohol is essential. Number 5. Social and environmental factors. Social and environmental factors such as your living conditions, social support, and workplace environment can impact your health. Evaluating these aspects can help in identifying sources of stress or risk. Number 6. Risk factors. Identifying risk factors such as high cholesterol or a family history of heart disease is a critical part of a health assessment. Knowing your risks allow for preventive measures. Why health assessment matters. A health assessment serves several crucial purposes. It provides a baseline for your health status, helping to detect problems early. It aids in setting health goals and tracking progress. Moreover, it guides healthcare providers in tailoring care to your specific needs. How to conduct a basic self-assessment. Measure vital signs. Regularly check your blood pressure, heart rate, and temperature. Maintain a health journal. Record your symptoms, diet, and physical activity. Understand your family history. Be aware of any hereditary health conditions. Seek professional guidance. Consult healthcare providers for regular checkups. A health assessment is the cornerstone of good health. It empowers you to make informed decisions, take proactive steps, and ensure a happier, healthier future. Stay tuned for more health and wellness insights on Medical Made Easy.